Hi, and welcome back. Today we're going to be finishing our very last summary lecture. We're going to be talking about the last chapters that I assigned in Infinite Reality, the book all about virtual reality, or again, I'll be calling it VR when I remember to call it that to save time. So you'll remember in the last chapters we talked a lot about how VR worked, like how it worked on a technical level and a psychological level. We're kind of continuing that conversation about how VR works on a psychological level, but specifically, I want to talk a little bit about how virtual reality affects us, not just in terms of like how it affects our behavior, but specifically our self-perception and behaviors related to our self-perception. On that note, one of the really important theories that I want you to know from this chapter, or from the first chapter that was assigned in, shoot, now I can't even remember which one it is, but it's the first chapter that's assigned for this week. Probably, let me think, probably chapter 6. The authors talk about self-perception theory, which has always been one of the more interesting theories for me, in part because it's so simple, but also because it's so interesting, which basically self-perception theory says that we don't just learn about ourselves by thinking about who we are. We actually pay attention to our own behaviors, and then we infer things about ourselves through the things that we do. So whereas a lot of people would think, oh, we know about the things, we do things because we know things about ourselves and we want to do things that are consistent with that. That's true. But sort of the inverse of that, self-perception theory would say, actually, though, sometimes we see ourselves doing things, and that's how we know things about ourselves. So one of the interesting examples that was brought up in the book was a study that was done looking at males, how they rated Playboy women in Playboy as being more or less attractive, and what they did in this experiment was they had the males listen to what they thought was their own heartbeat, but unbeknownst to them, some of the people in the study, they were listening to a heartbeat that sounded normal, and others were given a heartbeat and they thought it was their own heartbeat that was beating a little bit faster. And what they found is that at the end of the study, when they asked the participants to rate how attractive they thought the Playboy model was, the men who had thought they were hearing their heartbeat beat faster rated the women as being more attractive. So again, we can infer from this that because they heard their heartbeat beating faster, they sort of inferred that to think that, oh, I must like this model more. I must find her more attractive. Some other really interesting research that wasn't mentioned, but I like talking about is they've done studies about people wearing glasses and taking exams. Even glasses, by the way, that don't necessarily improve your vision. So what they would do is they would have different people come in and take a test, and they would randomly assign some people to wear fake glasses, essentially. And because people feel more brainy and they associate glasses with being smart, they actually tend to perform better on the exam. And again, it's another example of how people can sort of look at their external features or whatever's going on and then make inferences about themselves because of maybe what they did or what they're wearing and things like that. So how does this relate to VR? Well, a lot of the research on virtual reality and a lot of the different programs that are being developed from it focus on virtual doppelgangers, or your book mentions this concept of a virtual mirror. So you would have an avatar, right, that you would be interacting with in a virtual world. But what's really significant about this avatar is that it looks like you. So it's not just avatars that you create to look like somebody else, although obviously that's a different issue in itself. But I think some of the more interesting stuff has to do with what happens when you literally can see yourself in the virtual world doing different things. Again, if we would relate this to self-perception theory, it would suggest that if we see ourselves doing something, whether it's in an offline world or an online world, it could have very similar effects on how we perceive ourselves both in online and offline worlds, right? And this relates to what they call the Proteus effect. And I would argue that this is probably the most important concept I want you to know for this unit of the class. But I also think it's one of the more promising lines of research on virtual reality. The Proteus effect essentially is the effect of when what happens to us in the virtual world, it's kind of like Vegas. What happens to us in VR doesn't stay in VR. So we already know, right? We read last week about all of the different studies that they've done that show, hey, we kind of respond to things in virtual reality in the same way that we respond to to things outside of virtual reality, right? Okay, great, we know that. But what's really interesting is that the Proteus effect suggests that there's a carryover effect, such that it's not just that we respond a particular way in virtual reality, it's that how we respond in virtual reality will actually carry over, and it can affect our interactions and the things that we do and the things that we think outside of virtual reality. And that's pretty amazing if you think about it, because it suggests that we can design virtual worlds to actually have an effect in non-virtual worlds. So the example, and actually this is the study that I assigned for this week, if you want to do your study report on this, is a study that they had done looking at height. So what we know in offline worlds is that taller people tend to do better at negotiations, and there's all different types of reasons for that. I don't think it literally has anything to do with height. I think it has everything to do with self-perception, right? Going back to self-perception theory, and people feeling more confident and inferring that they must be capable if they have this, I don't know, bird's eye view of everyone. I'm 5 foot tall, so I can't relate. But right, so what they did in a virtual world is to demonstrate this. They would have, of course, given people an avatar that maybe looks like them. And to be honest, now I can't remember. I'll have to go back and look at the study if it was a doppelganger or not. But the point is, you have an avatar, and what they did is they varied the height, and then they had people have negotiations in a virtual world. Well, what would you expect? Obviously, the taller avatar won, okay? So the taller avatar tended to be a better negotiator. So that's interesting. What's really interesting, though, is that when they had the people who were behind the avatars in the virtual world then go out and engage in negotiations in an offline setting, in an actual like face-to-face, no avatar filtered setting, the person who had the taller avatar also won those negotiations. So even if the person in the offline negotiation happened to be shorter, because they had had an avatar that was taller, that seemed to carry over and affect their negotiation skills offline. Now, we do know, and I don't think this was mentioned in the book, I kept looking for it, maybe it was and I missed it, but usually there's only about a 20-minute persistence effect with the Proteus effect. So it's not like, oh, you have one virtual reality experience and as a tall person, and all of a sudden your whole life, your whole life outcome has changed, right? Where now you always win in negotiations, or now you always like walk with a certain like tall stride in your step or whatever, right? So certainly it's not, we wouldn't say that these are necessarily life-changing effects. But if you think about it on one level, these experiments probably aren't lasting that long. We don't really know what it would be like to spend hours on day upon day, right, immersed in some other immersed in some sort of virtual experience that gives you an experience that's different from your own, that could potentially have more long-term consequences to how you behave in non-virtual settings, for better or worse, by the way. And perhaps not surprisingly, I should mention, this book really focuses on all of the better, but I wouldn't mind talking about some of the potentially negative things that could come out of these effects too. Anyway, some other related effects, right, that come out of like Proteus effect research. So we know, for instance, in health communication that a lot of times people don't adopt positive health behaviors because they just don't feel like they can. It could be because, oh, I would like to exercise, but I don't think I'm disciplined enough, or I don't think I'm fit enough to keep up an exercise regimen, or whatever. They just don't have what we call self-efficacy. They don't have the feeling that they can actually accomplish what they need to accomplish, so they just don't. I don't feel like I don't feel like I can quit smoking, so I'm not going to, right? Whereas if people do feel empowered, I guess you could say, if people do feel like they have the resources, and if people think it's going to be effective, which is we call it response efficacy. If we think that, yeah, I actually think that if I started exercising, it would improve my heart health, or it would, do whatever effects that I want it to have. People are more likely to engage in those types of behaviors. So think about where I'm going with this for virtual reality. So if you are seeing yourself in a VR environment doing some sort of behavior, and you actually are looking at this representation, this avatar of yourself, as sort of a mirror, as a virtual representation of yourself, they found that this can actually improve your self-efficacy to do these types of things offline. So after spending some time with your, digital representation of yourself, doing some exercise, they found that people might be more willing to exercise offline, because it's almost as if like they already have it in their head that they can do it because they saw themselves doing it, right? Somewhat relatedly, they've done research, and actually, if you guys remind me, I can direct you to a video about this where you can actually see the setup that they had for this study. They talk about the implantation of false memories, right? Because it's as if like in the same way that VR can be used to enhance people's self-efficacy, because it's like seeing yourself do the behavior, so you have more confidence that you can actually do it because it's like I already did it. The same could be true, though, that people might have a difficult time remembering if they actually did do something or not. Now, as far as I know, they've only done this with children, which developmentally speaking, has its own implications. I think it would be much harder to implant false memories in adults, but what they did with children is they brought them into a lab and they showed their virtual avatar of, doppelganger, so it looked a lot like them, swimming with whales. And it was just like an immersive whale swimming experience that these children have. And then they invited them back in the lab several weeks later, and they found that a certain percentage of the children actually believed that it happened. Not all of them, but a significant percentage actually thought that this was something that they had actually had happen to them in real life, because it's sort of like they stored it in a memory compartment of themselves, of them doing something. Because essentially they did, you understand, they actually saw themselves doing something, or, their brain responded to it as if they were seeing a mirror or a videotape of themselves having swam with whales. So kind of freaky in a way, but also kind of cool, I hope you think. Finally, just one of the more interesting, in my opinion, there's a lot of interesting stuff, but I picked the stuff that I like the most. One of the more interesting lines of research is dealing with the question of, well, what if you have an avatar that doesn't look exactly like you, but gives you the ability to walk in somebody else's shoes? So what if you got to try on interacting in a VR world as somebody as a different race from you, or somebody who has a disability, or somebody who is older, right? All these different variations of yourself that could have been or could be in the case of older adults. Would that actually give you empathy so that it reduces maybe your prejudice, or it makes you more sympathetic towards other people's situation or whatever? And it's the research is suggesting that no, actually, it actually heightens people's stereotypes of other groups when they are forced to walk in the shoes of maybe an other group. It's funny, my colleague, Dr. Rittenauer, maybe some of you have had her, she teaches family communication and intergroup communication, and we did a study actually looking at an app called Oldify, where it takes your face and it ages you maybe 40 or 60 years, so that you have wrinkles and sunspots and everything like that. And what we were hoping, kind of the same, along the same lines, is that if people saw themselves as an older adult, it might lessen sort of the fear of aging, and also make them a little bit more tolerant of older adults. We know that people like older adults, right? But they also condescend to them a lot, and they don't, they might think that they're very warm, but they don't think they're very competent, right? And we were wondering if people were sort of forced to think about what it's going to be like when they age, if this would help. And sadly, the opposite effect was shown also with this one, where we found out that people, when they get to sort of experience their future selves, they don't necessarily have more, they don't necessarily have more understanding about older adults. If anything, they actually, it sort of heightens their fear of aging a little bit more. So that's kind of sad. We're working on, though, figuring out how we can change this to make it a little bit more productive. Okay, and finally, I just wanted to briefly, very briefly, the last chapter I assigned to you was chapter 12, and this was all just trying to get you to think about all the different ways that VR might be used in the future. Sorry, I think the garbage man's here. I mean, I can't go through all the different implications that they talked about. One of the big ones that I know that the authors are doing research on, particularly Balinson, they've gotten grants from the U.S. military to do all sorts of stuff. So you'll see a heavy, uh, a heavy amount of the chapter dedicated to talking about different ways that VR can be used for different military-related outcomes, including, for instance, right, helping soldiers sort of like get a better understanding of the people that they're going to be interacting with when they're in different countries. It can also be used for training, right? Flight simulators and other types of military simulators. They also talked about, this reminded me of Men in Black. Do you remember, like, where if they're trying to train military to sort of pick out dangerous people from civilians, right? This would be a possible training ground, right? You could do that in virtual worlds and actually sort of help help military personnel react a little bit more accurately and efficiently when they encounter different types of people. So that was cool. They're also using this, of course, in law enforcement. They talked about virtual lineups. They talked about consumer research, other types of training besides military, surgical training. I would definitely argue that one of the coolest medical uses of VR is pain management. They'll talk a little bit. This is another thing. I think it's actually on the video that I assigned of Balinson's lab, but I could be wrong. If not, it's another thing. If you ask me, I can post it later, where they have found that people with phantom limb syndrome who have pains after they've lost a limb, if they're allowed to sort of use virtual limbs in virtual worlds, it actually reduces their pain, which psychologically is fascinating if you really think about what that means, because it means that the brain is really responding to the virtual limb as if it's a real limb. And the really cool stuff, the burn victim pain management that they were doing, were burn victims, if they're immersed into a snowy world where there are snowmen and snow is falling and there's ice and it looks cool, right? This has nothing to do with the actual temperature. It's just telling the brain that it should be cool. They found that it actually reduces people who have severe burns. It reduces their pain, which is unbelievable. I guess finally, I just say, you know, just for mental health, I think there's a lot of really interesting potential for this. I know at Georgia State, where I got my PhD, there was a psychologist who was doing research on helping people overcome public speech anxiety by having them perform public speeches in virtual environments. And it's like, well, that's not really like giving a speech in front of like a real audience, but it is. Because remember, you know, like our brain responds to virtual reality like it does actual reality. They talk about using virtual reality therapies for PTSD and all different types of phobias, really anything where you may have learned this in your psych class, where you need immersion therapy, right? Where immersion or contact with something that you're afraid of can gradually reduce your fear. Virtual reality provides the perfect settings for that, because it actually puts you in an environment where your brain is forced to encounter these stimuli, but it's still safe because you're not actually encountering those stimuli. Height. I think about the pit test that they talked about in a couple chapters earlier. Okay, well, I think that's it. Please, if you want, read the rest of the book. I'm sorry that we couldn't cover more of it, because I think it is cool, and I think that there are a lot of other important implications to this sort of VR revolution. Now I'm being like hyperbolic maybe, but yeah, and I would encourage you to look at it, because I do think that this is going to be the type of thing that just becomes a little bit more mainstream. I want us on the discussion boards to just think about a little bit more ideas about how this could be used, or maybe even some more specific ideas. For instance, if we want to talk about mental health, you know, Facebook is purchasing, has purchased Oculus Rift technology, and it's one of those things that I'm still trying to wrap my head around. Like, how would we somehow one day use virtual reality in connection with social network sites? How would that enhance the experience, or what would we accomplish with that? I guess what I want to say is given what you've learned these past couple weeks, what are the types of things that you can envision for this? And it could be positive or negative. We've talked about, again, mostly positive things, but maybe some of this isn't all that great. You know, all of this potential isn't all that encouraging. Maybe some of it's a little scary, and I can understand that too. But I'd really like to hear your thoughts on it. So, okay, guys, Thank you. Bye.